Fox News medical correspondent, Dr. Mark Siegel. Doctor, good to have you with us.
Hello.
These numbers were static throughout most of the day. Then suddenly we got an update this evening. This is getting to be a bit worrisome, that the reporting structure is not as efficient as certainly the United States would expect. Your thoughts?
That's one thing, that we're not getting, the case reports are delayed, that suddenly another 2,000 cases occur in China. But the other issue that's come out over the last few days, Lou, is it may have actually started as early as November, and that the reporting, we already knew it was delayed, that it was suppressed by the Chinese government. But you know what that means? It means that there are thousands and thousands of cases out there that never got properly diagnosed.
In China.
In China, which means, though, it may have spread asymptomatically, or mild cases could have spread before we were tracking them, could have gone to other countries, including here.
It could have, as you say, but the reality is we have such a sophisticated public health system in this country. The likelihood of that, it seems to me, at this point, we're, what, 3 weeks into this, are remote because we don't have any surprise surge here in cases in this country, at least that I'm aware of.
That's completely fair beyond mild cases. There may have been some mild cases that we didn't know were coronavirus, but we're doing an incredible job here. Just to give you the numbers on this, there's 12 cases confirmed. There's 68 cases still under observation by the CDC. And people that have been flown in and evacuated from Wuhan, we have 800 people in quarantine on military bases, CDC physicians overseeing this. We're doing a tremendous job here, our Centers for Disease Control, and it's really disturbing that the CDC is not yet allowed into China.
And later in the show, we're going to update the number of cases because we have several cases that now are just one day beyond 2 weeks that should have been cured. We're going to find out the status of those cases as well. I want to return to China because now there's starting to be some consternation about the fact that we have not been able to get our teams into China. The World Health Organization has not been able, the Chinese have not allowed them to go in either. There's some politics being played here, certainly in this country, that in the World Health Organization in particular, wanting to go nice and easy with the Chinese. I get that. What I don't get is not being straightforward about it, because there's a very real risk that not being straightforward with the American people about the fact that the Chinese government is not permitting those teams in could lead to real skepticism about the other things that the science and public health community and medical community are reporting to us.
I also think what you just said is completely fair, and I want to point out gently that the member of the World Health Organization in charge of communicable diseases was a public health official in China for over 30 years. And so there may be politics directly at play. The WHO is finally being allowed in now. 15 officials will be there. CDC may be part of that, but we need the CDC to have boots on the ground. We're not seeing it. I do think that this disorganization and disarray in the quarantine situation, we don't have the same infrastructure over there. Lou, we have great hospitals here. We don't have the same health care there, and it leads to more viral spread.
And what is your sense? They have denied the U.S. teams since January 6th, if the numbers that, if the dates are correct, that this disease started, well, at least a month earlier than we originally were told. What are the implications of that for the Chinese?
Oh, I think it implies almost directly that they've been suppressing and hiding some information. And it's very disturbing to a physician like me. Let me tell you what they're not hiding, thankfully. The virus itself has been published online. That's been shared by scientists around the world. And 2 studies came out of China over the past week that shows that most of the people that have died from this have either been elderly or immunocompromised or have had chronic diseases. It's milder in younger people. That's somewhat reassuring, but I'd like to know the vast array of the real numbers and who exactly is getting this and who's at risk.
Now, you referred to the World Health Organization and the influence, in effect, of China in the operations. They've got a number of positions that Chinese nationals hold. Are you suggesting that that's influencing World Health Organization decision-making?
I am. And I think that China carries a lot of weight because of their position in the United Nations. And I think that that's played a role, not in suppression. I'm not saying the WHO is complicit in suppression. I'm saying they should have been involved from the very beginning, spreading information, getting other countries involved before the virus was spreading to these countries. We have Singapore now increasing number of cases, Japan increasing number of cases.
When do you expect to see an abatement in this in the spread of this disease outside of China?
Well, so that has to do with how well it has sustained spread outside of China. We saw 14 cases in Great Britain over the past day from one incidence case. That worries me, that it spread from one person to 14 others. Here in the United States, with everything under lock and key, we're doing a better job. I think it's going to get worse before it gets better. I think in the spring, in April, you're going to start to see this die out for no other reason, because respiratory viruses don't do well in that kind of climate. When it gets warmer and more humid, we're not going to see this. In the meantime, a lot of work goes on antiviral drugs. Those are potential, and a vaccine about a year away.
We're hearing occasionally a report that an antiviral has shown promise within a matter of hours in treating at least one patient. We're hearing that a number of companies are moving ahead with vaccines as well as virals. Anything in prospect right now in real terms?
Yes. Remdesivir is one antiviral drug. It was used against Ebola. It was used on the patient in Washington State. He got better. He went home. That's very promising for the use in coronavirus.
And by the way, just the report is that he showed improvement within hours.
Absolutely.
So.
Another, in Thailand, they're trying an HIV drug together with a flu drug. That is showing promise. And the third possibility is to use antibodies. Regeneron has antibodies that are targeted directly against this virus.
Dr. Mark Siegel, thank you, sir.
Good to see you, Lou.
Appreciate it.